Today, we will discuss hyperkalemia, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Hyperkalemia is a condition where there's too much potassium in your blood. Potassium is a mineral that's important for your muscle and nerve function, but having too much can be dangerous. Signs you might have hyperkalemia. 1. Muscle weakness. Feeling weak or tired, especially in your muscles. 2. Fatigue. Unusual tiredness or lack of energy. 3. Heart palpitations. Feeling like your heart is beating too fast or irregularly. 4. Nausea. Feeling sick to your stomach. 5. Tingling. Experiencing a tingling sensation, especially in your hands or feet. How to know for sure. Blood test. The only way to confirm hyperkalemia is through a blood test that measures potassium levels. See a doctor. If you have symptoms or concerns, it's important to consult a healthcare professional who can perform the necessary tests. If you suspect you have hyperkalemia, it's best to seek medical advice promptly, as it can lead to serious complications if untreated. If someone has hyperkalemia, too much potassium, here's what to do in simple steps. 1. Stay calm. Keep the person calm and comfortable. 2. Seek medical help. Call a doctor or go to the hospital. Hyperkalemia can be serious. 3. Don't eat potassium-rich foods. Avoid foods like bananas, oranges, potatoes, and spinach until a doctor says it's okay. 4. Follow doctor's orders. If a doctor gives treatment, make sure to follow it carefully. This could include medications or other interventions. Always prioritize getting professional medical help when dealing with hyperkalemia. In the hospital, here's what doctors might do to treat someone with hyperkalemia. 1. Check levels. They will start by checking the potassium level in the blood with a test. 2. 4 treatments. They may give medications through an IV to lower potassium levels quickly. This can include calcium to protect the heart, insulin and glucose. This helps move potassium back into the cells. Sodium bicarbonate, sometimes used to help lower potassium. 3. Diuretics. They might give medications that help the body get rid of excess potassium through urine. 4. Dialysis. In severe cases, they may use dialysis, which is a machine that filters the blood to remove extra potassium. 5. Monitor heart. They will keep an eye on the heart with monitoring equipment, as high potassium can affect heart rhythms. 6. Dietary changes. Once stable, doctors will discuss avoiding potassium-rich foods and managing overall potassium intake. The goal is to safely lower potassium levels and prevent complications. Here are some commonly used medications for treating hyperkalemia. 1. Calcium gluconate or calcium chloride. These are used to protect the heart from the effects of high potassium levels. 2. Insulin with glucose. Insulin helps to lower blood potassium levels by driving potassium back into the cells. It's often given with glucose to prevent low blood sugar. 3. Sodium bicarbonate. This can help shift potassium back into cells, especially in cases of acidosis. 4. Beta agonists like albuterol. Inhaled medications that can also help lower potassium levels by stimulating the cells to take up potassium. 5. Loop diuretics like furosemide. These help the kidneys excrete potassium through urine. 6. Patiromer or sodium zirconium cyclosilicate. These are newer medications that bind potassium in the intestines, helping to lower levels over time. Always remember that treatment should be guided by a healthcare professional based on the individual's specific condition. Certain people are more likely to develop hyperkalemia. Here's a simple breakdown. 1. Kidney problems. Those with kidney disease can't filter potassium well, making it easier to have high levels. 2. Heart conditions. People with heart issues may be more affected by high potassium levels. 3. Certain medications. Some medicines, like certain blood pressure drugs or diuretics, can raise potassium levels. 4. Diet. Eating a lot of potassium-rich foods, like bananas and potatoes, can increase risk, especially if the kidneys aren't working well. 5. Dehydration. Not drinking enough fluids can lead to higher potassium levels. 6. Older age. Older adults are generally at higher risk due to kidney function changes and medication use. 7. Hormonal disorders. Conditions like Addison's disease can affect how the body handles potassium. If someone falls into these categories, they should be more aware of the risks related to potassium levels. Now you need to watch my video on alcohol withdrawal or have a look at seizures.